Hello and welcome. My name is Dr. Eric Chapman, Medical Director and owner of Allegiance Health of Southwest Florida. Today we're going to be talking about color vision testing and its relation to occupational health, occupational medicine exams. Different jobs, different employers need vision testing. One of the components of vision testing is color vision. Different ways to test for color vision. For example, it may be important in a Department of Transportation exam to make sure that a bus driver can distinguish between red and green and yellow colors. But we also know it's important for Coast Guard physicals. Here in South Florida, we have a lot of commercial fishermen, boat captains, U.S. Coast Guard personnel. They also need color vision testing. If they go on the water in the different shades of green and turquoise and aqua, depending on the cloud cover, if you cannot distinguish between red and green and all these different shades of color, depending on the conditions, it may be difficult to navigate, for example. Another field that needs color vision testing is aviation. Pilots need to distinguish between colors as well. So that's why color vision is important, and there's a lot of different ways to test it. One of the ways that we do it here in the office is with color plates. You can use all sorts of different kinds of ways to test vision. We find this the most interactive and the easiest for patients. So this is a color plate booklet, and if you flip open here, for example, different dots of different colors will allow the patient to visualize number, and you have the patient read the number that they're able to see. So if this patient had no deficiency in red, they'd be able to see the number 12, and so on and so forth. And you can see that there's different shades of red, different shades of green, and certainly not the only way to test for vision, but we find it's the most interactive and the most efficient way to do it here. Color vision is predominantly an issue with male patients in the way the trait is passed on genetically. Overall, this is something that we do routinely in our occupational medicine visits. It's also something that can be done for your overall primary practitioner. It's a good screening tool. Some patients come into the office and don't even know that they have a red-green deficiency. But of course, in occupational health, it's very, very important to try and uncover that and work with the patient, not just for their safety, but for public safety. You would want a bus driver, for example, to clearly be able to differentiate between a green traffic light and a red traffic light and a yellow traffic light. So overall, this is what we do here, apart from many of the occupational medicine visits that we have here in our clinic. Be sure to follow us for more up-to-date videos on all sorts of topics, whether it's DOT testing, aviation physicals, wellness exams, medical health, the business of medicine. Stay tuned for a lot of different videos. Thank you.